So during the first puppy exam or during our puppy series, we go ahead and we look at our eyes, make sure that they're nice and clear. There's no eye discharge. We also check and make sure that there's no congenital defects such as cataracts that can be passed down from parents. We move on to the nose. We again check to make sure there's no signs of discharge. We make sure that there's good flow from both nostrils. You're all right, bud. We check our mouth, see how our little deciduous teeth are. You're all right, bud. Make sure our gums are nice and pink, that we're able to oxygenate our tissues okay. Okay. We also check the upper palate, make sure that there's no congenital defects there, such as a cleft palate. The cleft is supposed to close during formation, embryonic development. We go and check our lymph nodes, make sure that those are the appropriate size and that there's nothing enlarged there. Then we check our heart sounds. We check and make sure that there's no sounds that are indicative of a murmur. Some murmurs as puppies are okay. They're what we call innocent murmurs and go away as the heart continues to develop. We check and make sure our lung sounds are clear and we don't hear any crackles or wheezes, any signs of infection within the lungs. We palpate their little bellies. We can tend to find the caudal borders of the liver, make sure that those are the appropriate shape. We can feel our back part of our kidneys as well, make sure those are nice and round. Just squeeze a little toot out of this guy, I was pushing hard enough. Feel our intestines and our bladder. Feel our joints, make sure we have good range of motion there, and again we palpate for lymph nodes in the back. I always take a good look at their skin, make sure we have no signs of any external or ectoparasites such as fleas or ticks on them. And then the last thing we do is take a temperature and make sure that they are a normal body temperature and are healthy enough for vaccines. Good boy. Good boy. Once we know that they're healthy enough for a vaccine, we put the vaccine in a specific location so that if they have a reaction to the vaccine, we know for the next time which vaccine it was that caused the reaction. You're okay, then. You're okay. Good boy. And then after every visit, we like to have a consult with the owner, make sure that potty training is going okay, there's no adverse behaviors developing such as aggression or not playing well with other puppies or dogs. And we also like to talk about obedience training. We usually discuss socializing if you already have a pet at home. What's the best way to introduce a new dog? Unfortunately, usually by the time we see them, they've already had that, so we discuss at that visit if they're having any issues with it, how to correct those issues. We give their first vaccine at about 8 weeks, and then from there we do every 3 to 4 weeks until they're 16 weeks of age. At 16 weeks we give them their rabies vaccine, and by that point they've had 2 or 3 of their booster series, which covers hepatitis, parvovirus, adenovirus, and parainfluenza virus. So lepto it's considered a non-core vaccine, so it's optimal. In the state of Florida, I highly recommend the lepto vaccine because leptospirosis is a bacterium that wildlife tends to carry and shed in water. So any standing bodies of water, such as puddles, sometimes when you go to a dog park with your kiddo and there's a drinking bowl, you never know at night whether any sort of wildlife has visited that drinking bowl and shed that lepto in there. The leptospirosis tends to like to colonize the kidneys and the liver and can actually cause kidney and liver damage or failure. And so by giving that vaccine, we can really help minimize that risk to our pets. Heartworm medication, we like to start at 8 weeks of age. So we start that. We usually tend to give them a puppy kit, which includes their first dose of heartworm medication. They can also get a first dose of flea products such as NexGard for free. We start talking about dental health during the first visit as well too. We start saying that if you want to try getting the puppy used to having a finger in the mouth or a little finger toothbrush in their mouth, we like to say that that promotes being able to do that later on in life and keep those teeth healthy. God, we can always talk about things like Oravet dental chews, which help to minimize the amount of bacteria in the mouth and help to resist bacteria adhering to the tooth surface. Spaying and neutering, we discussed that during the first visit as well too. They say puppies are big enough once they're past 2 pounds to be spayed or neutered. I usually say around 5 or 6 months of age is a good time to have them spayed or neutered. That way we make sure that we get them spayed or neutered before they go into their first heat cycle or reach sexual maturity.